My name is Dr. Katya. Welcome to your cranial nerve exam. If you don't mind, we're just going to start off with a few simple questions just to make sure your cognitive function is intact. Can you just start off by telling me your name and your date of birth? Okay. And do you know what year it is? Okay. And do you know what month it is? Okay. Do you know the date? It's okay if you don't, I forget all the time. I think today is the 7th. I could be wrong. um, okay. And do you know what country you're in? Okay, good. Now, can you count to 5, starting at 1? Good. And can you say your ABCs just until the letter F? Okay, good. And can you say your ABCs backwards from the letter Z to the letter W? It's a little tricky. Good enough. Okay, some basic questions have been succeeded, and we can now move on. I just want to apologize in advance if you hear any traffic noise outside. I am currently trying really hard to relocate our office to a more quiet location. Um, we've had this downtown location for a couple years now, and while it is convenient for people to walk here, it is just a little noisy for these tests. So if you hear any traffic sounds, I am sorry, but just know that I am truly, truly trying to relocate somewhere quieter. Okay. Thank you for your patience. All right, we are going to start your eye exam now. And going to start with checking your pupils. I will be using a light, but I will give you breaks between exams with the light just to give your eyes time to adjust, relax. So I'm going to be using this little panda here. You could just focus on the panda, your eyes on the panda. Just going to test your pupil response and make sure that they are dilating with the light. Okay, keep looking at the panda. So far, so good. Okay, and keep looking at the panda, and I'm going to do a quick swing test. That wasn't a good swing. Let me try again. Good. Okay, now we're going to do just another pupil check. I am going to cover this eye and just look at this one. You can blink if needed. It won't interfere with the test. Good. Okay, go ahead and blink a couple times. Blink, blink, just before we get back into this. Okay, now I am going to cover this eye with the panda and check your other eye's response. Good, good, good. Okay, go ahead and blink, blink. Good. And give your eyes just a little break from the light. We are going to move on to a different exam. Okay. For this test, I will be using an eye chart. Just need to make sure we are at an arm's distance away. We are. Perfect. We are going to start with the colors on the bottom. Can you see the colors? Good. Can you tell me what color this is? And what color is this? This. I realize I was covering up. Okay, good. And you can see all the colors clearly. None of the colors appear to be brown or gray. Okay, good. Now we're just going to do the same thing. If you can tell me the color and the letter or number. So this, for example, is red 5, purple C. I'm giving away the top line because everyone can see that one, hopefully. Okay, so this blue P, 3, 6. Okay, now the rest of them I'd like you to do on your own. And I'm just going to do one line at a time until you can no longer make out the letters or the colors. Good job. And now this one. Okay, and then if you can read this line. Make sure you're telling me the colors too. Can you tell me what color this is? Can you see it from there? Okay, good. And then if you can see the last 3 lines, that's great. But if not, you have already made it to the 2020 vision line. Anything past this is just like superhero level vision. Okay. Good enough. Good job. I'm just going to write down these results really quick. You do have 20/20 vision. No signs of color blindness. And your contrast seems to be fine. Excuse me. Okay, now we're going to get the flashlight back out. And I am going to use a slightly dimmer light this time. Just need you to follow the light. I'm going to start by bringing the light in and out. So if you can just follow it in and out. Okay, good. I'm going to do that a couple more times and probably from a few different angles. You can just keep following in and out. And out. Good. Now, from this angle, in, out. Good. Down here, in, and out. Good. In, and out. Good. In, out. Okay, good. Now, go ahead and blink. Give your eyes just a little rest. Blink and blink. Good. Sorry again for the traffic. Now I just want you to follow the light. I'm going to start off slow, and then I will speed up. Good. Up, down. Good. Left, right. Okay, keep following. Good job. Good job. Okay, and I just want to test your eye muscles really quick. So if you could just blink on this side, blink, I guess wink, wink on this side, and wink on this side. Okay, and now blink both eyes. Blink, blink, blink. Okay, wink, wink. Okay, now I want to test your eyes' response. So go ahead and close your eyes and keep them closed. And I'm going to count to 3. When I get to 3, I just want you to open your eyes. Just as simple as that. Okay, so go ahead and close your eyes. 1, 2, 3. Okay, good. We're going to do the opposite now, so keep your eyes open until I count to 3. Keep them open. 1, 2, 3. Go ahead and close your eyes. Good job. Good job. Now I'm going to take the stick and I'm going to get close to your eyes. When you sense that it's too close, blink. Okay? Okay. Good. 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 Okay. All right. We are done with the eye portion for now. There are a couple of more tests later on that will involve your vision, but for now, your eye motility is good. Your eye muscles are good. Response time is good. Oh, I need to test your eyes' tear reproduction rate just to make sure they are reproducing enough tears. So go ahead and blink and hold your eyes closed just for a few seconds. I'll count to 3 again and then you can open your eyes. So go ahead and close your eyes. 1, 2, 3, and open them. Good. Now I would like you to keep this eye open as long as you can. If you have to blink, it's fine. I just want to see how long you can keep it open. We're going to try for 5 seconds, okay? 1, 2, 3, 4, 5. Good. Go ahead and blink and keep your eyes closed. 1, 2, 3. I can't wait to move off of this eye. I'm so sorry. All right, now we're going to test this eye. Once again, just trying to keep it open until I count to 5. 1, 2, 3, 4, 5. Good job. Good job. Go ahead and blink. Give your eyes a little rest before we continue on. Okay, now with no light, I just need you to open your eyes and look up. Actually, let me get this guy. Just look up. Good. Look down. Okay. Over here. And now over here. Good job. Now we are done with the eye exam. Sorry we had to go back. Let me just make sure I write this down. Ducks are working. Moisture levels accurate. Okay, good. All right. Now we're going to move on to the hearing test. Clearly you can hear just fine since you've heard the copious amounts of traffic. But we are going to test and make sure both sides are working. So you can keep your eyes open or closed for this. There is going to be a portion soon where I will close your eyes, but for now you can just keep them open. Just tell me which ear you hear the snap come from. That was both, okay. I can't snap as well with one side. Okay, good. Now I'm going to perform a beep test. I'm sure you had this done before in grade school. So it's just going to be a series of beeps, and I need you to do the same thing and tell me which side it's coming from. I am going to cover your eyes just to make sure you're not cheating. Not that I think you would cheat, but just to be certain. And it's the same thing. I just need you to tell me which side the beep is coming from. So I'm going to get a little bit closer for this. Cover your eyes. Up this side. Good. Okay, and just tell me which side you hear the beep from. Okay, I'm going to decrease the volume of the beeps just a little bit. If you can hear these, great. If you can't, no worries. Okay. Alright, Okay, how was that? Did you hear from both sides? Okay, good. All right, now write down the results really quick. Oof, I'm getting a little red. It's pretty hot in here. Sorry about that. I would turn a fan on, but I don't want it to interrupt the hearing tests. All right, let me write down your hearing results really quick. Like both sides are acute. It's fluid. No signs of hearing loss. Good. Okay. Now for our final test, I just want to test the muscles of your face, just to make sure everything is symmetrical and that both sides of your face are working. I'm going to test different quadrants and just make sure that everything is right neurologically. When the face symmetry is off, it can be a sign of neurological problems or a stroke. Um, Nobody's face is perfectly symmetrical, but we want to make sure that there's no drooping or frozen movement. Okay, so just to start off with, go ahead and rest your face, just relax. I've been looking at you this whole time and I haven't seen any signs of atrophy, so good. Now, if you could just raise your eyebrows and up, hold them up. 3, 2, 1. Okay. Go ahead and rest your eyebrows. Can you squish your eyes shut really tight and hold it? 3, 2, 1. Okay, everything looks good there. Um, can you wink again? Just wink this eye and wink this eye. Okay, good. Right? Can you furrow your brows like you're angry? Okay, hold it. 3, 2, 1. Good. Okay. Can you scrunch up your nose like you smelled something bad? Okay, hold it. 3, 2, 1. Good. Now, can you sniff with your nose? Just okay. Can you do it 3 times in a row? Okay, good. Good, 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 good. Okay, now we're gonna do some more simple tests. So if we could just smile without showing teeth and hold it. 3, 2, 1. Okay, good. And if you could just frown now, frown and hold it. 2, 1. Everything looks okay. Now, if you can purse out your lips like a kissy face, hold it. 3, 2, 1. Okay, relax. Now begin puff out your cheeks and hold that. While you do that, I'm gonna add just a little bit of pressure. Just good. 3, 2, 1. Okay, good, 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 good. All right, go ahead and just move your face around a little bit so you can reset your muscles. Now, can you smile with your teeth and hold it? Three, two, one. Okay, good. Can you open your mouth and just hold it? Two, one. Good. Stick out your tongue. Move your tongue to this direction. Move your tongue to this direction. Put your tongue on the roof of your mouth. Hold it. Three, two, one. Okay. Can you curl your tongue? Stick it out and hold it. Three, two, one. Okay, good. You can put your tongue back in your mouth. Actually, stick your tongue back out. This isn't a part of the cranial nerve exam, but as a doctor, I just want to check. Keep your tongue out. Just okay. I'm gonna check your throat really quick too. Go ahead and say ah. Stick your tongue out and say ah. Ah. Okay, good. Now relax, relax, relax. Okay. I think we covered everything. Let me check. Actually, really quick, just one more thing. I need to test your jaw movement. So you can just open your mouth and then bite. Don't bite hard enough to hurt your teeth, but just okay. Can you open your mouth and bite again? Okay. Now open your mouth as wide as you comfortably can. Don't don't do it until it hurts. Okay. Have you ever had any problems with TMJ, jaw stiffness? Can sometimes occur with anxiety. Okay. Can you open your mouth and move your jaw to this side and then to this side? Okay, good. And then I'm just going to touch your jaw. If you can just close your mouth and clench your teeth. Don't do it until it hurts, but just clench. Three, two, one. Okay, good. Alright. I just want to make sure you still have sensation at the top of your head. So I'm just going to scratch the top of your head. Just tell me if you can feel it. Okay, good. Alright. Well, you did great. It doesn't appear to be anything wrong with any of your cranial nerves. Um, Whenever I move offices, I will make sure to send you a postcard letting you know of the new address. I have your address here. It hasn't changed, right? Okay, good. Yeah, hopefully within the next few months, I'll have a new office. And it'll be even more relaxing and quieter. Until then, I hope you do well. See you soon.